first aid. Subject is first aid. In that, the electrical shock. Today's lecture is about the electrical shock. The electrical current, including the lightning, can cause the severe damage of the body, and the skin is burned where the energy enters into the body and where it is flows into the ground. Okay. The electrical shock means what? When there is a sudden discharge of current through the body, it is said to have undergone electrical shock. ओके. जेव्हा आपल्या शरीरामध्ये एखादा करंट, एनर्जाइज करंट जातो आपल्या बॉडीमध्ये, दॅट इज कॉल्ड अ इलेक्ट्रिकल शॉक. द फिजिकल कॉन्टॅक्ट ऑफ एनर्जाइज वायर or electrical device are most common cause of electrical shock. In that, safety is the burns or the injuries is due to the electrical burns or injuries due to electricity are often very hazardous. Assume that the source of electricity is still active unless a qualified person tells that the power has been turned off. Don't attempt the rescue unless you have been trained to do these kinds of rescue and have necessary equipments and personals. जोपर्यंत तुम्हाला व्यवस्थित माहीत नाही आहे तोपर्यंत तुम्ही त्या पेशंटला हात लावू शकत नाहीत आणि व्यवस्थित इक्विपमेंट्स नसतील तरीही तुम्ही त्या पेशंटला हात लावू शकत नाही. कॅज्युअलिटीज असेसमेंट. साइन्स अँड सिम्पटम्स ऑफ द इलेक्ट्रिकल शॉक्स आर burns where the energy enters and exit the body's disrupted nerves pathways, displays or paralysis, muscles tenderness, respiratory difficulties or respiratory arrest, irregular heartbeat, cardiac arrest, elevated blood pressure, then restlessness, irritability, visual disturbance, and visual difficulties, fracture bones and seizures. Okay, these are the causes, these are the signs and symptoms of electrical shock. In that, the burns where the energy are enter, जिथे जिथे आपल्याला शॉक लागलेला आहे त्या साईडला जळाल्याचे निशाण असू शकतं किंवा बर्न्स सिव्हिअर बर्न असू शकतं किंवा डिस्टर्बटेड नर्व पाथवेज, द मसल टेंडरनेस होऊ शकतो, रेस्पिरेटरी डिफिकल्टीज, high blood pressure, restlessness, irritability, visual difficulties, fracture bones and seizures. Seizures means the seizures मराठी meaning is आकडी वगैरे येऊ शकते पेशंटला. Even if the person is not injured, make the medical help. पेशंटला जरी इंजुरी झाली नसेल तरी त्याच्यासाठी मेडिकल हेल्प घ्यायची. If the victim is not responding, unconscious, give CPR to the victim. Do not touch the victim. Immediately switch off the current, electrical power supply. Always wear a pair of rubber gloves while operating power tools. Make sure that the surface you are operating on in clean air and dry. Also, your hands must be clean and dry. Turn off or disconnect the appliances before you operate them. In the severe shock, there is a severe bleeding may be present, heart problems are present, loose body fluids. The signs symptoms of the shocks are irregular heart rate, burn at the site of shock, electrical shock, then elevate blood pressure, unconscious irritability, visual disturbance, seizures. Okay, these are the signs and symptoms. Irregular respiratory rate, now how to give the treatment outside the house if the patient is on the undergoing the shock condition. How to operate the patients? Okay, person remove the live wire shock with the stick, wooden stick ने आपण ती वायर बाजूला करायची आहे. use the rubber gloves while removing the wire. And in the house, if there is a shock, the treatment is with the help of wooden stick, remove the wire, switch off the main button, then remove the live wire with the help of stick. Okay, in house and in outside the house. Okay, how to remove the live shocks the wire with the help of stick, and when the patients undergone this wire, use the rubber gloves and remove the wire. Emergency care, make the sure the client and casualty and first aider are emergencies are provided are in safe zone, often open and provide the airway care. जसं CPR आपण शिकलोय त्याप्रमाणे CPR द्यायचं आहे पेशंटला. प्रोव्हाइड अ बेसिक लाईफ सपोर्ट ॲज रिक्वायर्ड, केअर ऑफ शॉक, ॲडमिनिस्टर हाय ऑक्सिजन कॉन्सन्ट्रेशन, केअर ऑफ स्पायनल इंजुरीज, हेड इंजुरीज अँड सिव्हिअर फ्रॅक्चर्स. जर पेशंटला फ्रॅक्चर झालं असेल, हेड इंजुरी झाली असेल किंवा स्पायनल इंजुरी झाली असेल त्याप्रमाणे केअर द्यायची आहे. ऑल सिरियस इलेक्ट्रिकल शॉक क्लायंट शुड बी फुल्ली इमोबिलाइज बिकॉज द इलेक्ट्रिकल करंट्स कॅन कॉज द सिव्हिअर मस्क्युलर कॉन्ट्रॅक्शन होतं सिव्हिअर शॉकमध्ये, त्यामुळे पेशंटला इमोबिलाइज करायचं आहे. इव्हॅल्युएट द इलेक्ट्रिकल बर्न्स लुकिंग for at least 2 external burn sites, contact with the energy source, cool the burn areas and molding clothing, apply dry sterile dressing on the burn sites, transport the patient as early as possible in the hospital. While giving the artificial respiration, use the methods of artificial respirations. Okay, electrical shock म्हणजे when there is a sudden discharge of currents through the bodies and it is said to have undergone electrical shock. The physical contact with the energized wire or electrical devices are most common causes of electrical shock. The signs and symptoms of electrical shocks are irregular heartbeats, burn at the site of electrical shock, elevate the blood pressure, irritability, visual disturbance, seizures and irregular respiratory rate. In this condition, in emergencies, use CPR. Okay, artificial respiration methods, different types of the 3 types of artificial respiration methods are used. Give the safe comfortable position to the patient. If there is a severe shock, if there is a severe burn, look at the burn site, give dressing to the burn site, apply the dressing on the burn site, okay, and shift the patient to the hospital as early as possible. This is all about the shock, electrical shock. Treatment of electrical short outside the house. See this diagram. Remove the live wire with stick. Use rubber gloves. This method is used outside the house. Then second method, inside the house, electrical shock and the treatment inside the house. Switch off the main current and remove the live wire with the help of wooden stick. Stand on non-conducting material while giving care to the patient. First, stand on the non-conducting material, means wooden pad. Never give unconscious patient for anything to drink. And use artificial respiration methods for giving the CPR. These are the artificial respiration method which are already seen in the CPR chapter. This is the second method of artificial respiration.